Welcome to Manthana Labs, your clinical AI imaging co-pilot. The dashboard shows imaging, pathology, ECG, and photo counts. Specialized workflows include allopathy and Ayurveda systems. Derma, voice, and tongue analysis experts are available. Features under development include Jarvis and genomic intelligence. Start a multi-modality patient study for unified reporting. Choose auto-detect or manual upload for investigations. Manual mode lets you select 2, 3, or 4 legs. Auto-detect is recommended for streamlined workflow efficiency. Select patient files from your local system directory. Multiple files upload simultaneously for bulk processing. Add optional clinical notes for the vision agent. Click Auto-Detect Modalities to begin AI clustering. The system processes and detects each file's modality automatically. Detection in progress for all uploaded investigation files. AI identifies 3 distinct modalities from uploaded images. Review detected legs and confirm or adjust assignments. Chest X-ray is detected as leg 1 automatically. Select appropriate modality from comprehensive drop-down menu options. Options include X-ray, Connecticut, MRI, ECG, and pathology. Proceed to combine questionnaire for patient clinical history. Enter patient demographics including age, sex, and duration. Specify primary clinical indication for each investigation leg. Document presenting symptoms like cough, dyspnea, or chest pain. Record symptom duration and relevant cardiac history details. Capture smoking history and pulmonary disease status accurately. Brain Court diagnostic brief requires clinical indication input. Flag comorbidities like diabetes, hypertension, or immunosuppression status. Note prior imaging and red flag features if present. Confirm ION-assisted research consent before final submission. Auto-detect diagnostic brief captures primary clinical indication efficiently. Flag significant comorbidities like diabetes for accurate risk stratification. Select diabetes and hypertension from the comorbidity checklist options. Brain Court standard brief requires similar clinical documentation steps. Type primary indication directly into the designated text field. Enter Find Out combined route cause as clinical indication. Scroll to auto-detect recommended brief for additional modality input. Document Find Out the route cause for third leg indication. Multi-modality correlation section explains why studies are combined. Scroll up to review complete patient questionnaire entries. Verify patient demographics. 55-year-old male patient. Symptom duration exceeds 3 months for this case. Chest X-ray symptoms include cough, dyspnea, and 18th chest pain. Click Submit to initiate multi-modality analysis processing. System uploads legs and starts analysis automatically. Analyzing your study with AI-assisted clinician review workflow. Clinical agent swarm activates with primary analysis agent. Progress shows 15% completion during inference stage. Computing density vectors for advanced image characterization. Ingesting pixel matrix for computational processing now. Segmenting anatomical regions for precise localization mapping. Outlining visual findings for structured report generation. Loading images for all legs simultaneously in background. Analysis takes 3 to 5 minutes based on queue. Feel free to switch tabs during processing time. Notification time alerts when analysis is fully complete. Guideline agent cross-references clinical standards during review. Interrupt agent ensures seamless modality integration across platforms. Synthesis agent compiles unified findings from all sources. AI Swarm delivers comprehensive multimodality clinical intelligence report. Multimodality study results now fully loaded. Chest X-ray shows cardiomegaly and congestion. Bilateral pleural effusions detected with confidence. Cardiac device lead visualized in mediastinum. Switching to Brain Court scan view. Acute intraparenchymal hemorrhage identified critically. Mass effect with midline shift present. Leg 3 shows hematology auto-detect results. Lymphopenia and monocytopenia flagged automatically. Elevated McShee noted on blood panel. Reasoning replay traces AI diagnostic pathway. Cross-modality synthesis correlates chest and brain findings. Hypertensive crisis manifestations unified across modalities. Severe end organ damage secondary to hypertension. – Acute decompensated heart failure on imaging. Intraparenchymal hemorrhage, common hypertensive complication. Mass effect causing ventricular compression identified. Midline shift 5 to 7 millimeters documented. Elevated intracranial pressure with herniation risk. Narrative summary synthesizes complete clinical picture. 55-year-old male with critical multi-organ involvement. Confidence breakdown shows model probability metrics. Region localization and cross-frame consistency displayed. Systemic stress and inflammation from hematology correlated. Bilateral pleural effusions contributing to dyspnea. Information gaps highlight missing clinical data. Neurological exam and coagulation profile needed. Clinician review confirmation required before proceeding. Accepting clinical responsibility for final report. PDF report generated and downloaded successfully. Opening the generated PDF report now. Header shows verified Dr. II Copilot status. Study ID and date clearly documented. Clinical narrative summarizes complex presentation. Information gaps section highlights missing data. Foundation model caveat explains synthesis methodology. Multi-modality correlation insights section displayed. Convergent etiology links hypertension to events. Acute decompensation and catastrophe detailed. Systemic response from CBC correlated clinically. Clinical analysis findings enumerate 11 items. Critical finding 1. Hypertensive crisis manifestations. 98% confidence with ICSD codes. Recommendation for aggressive blood pressure management. Systemic stress and inflammation flagged medium. Cardiomegaly marked high with 95 confidence. Pulmonary vascular congestion shows heart failure. Bilateral pleural effusions documented with differentials. Cardiac device lead noted as expected finding. Mass effect with midline shift critical. Lymphopenia and elevated McChie from hematology. Critical findings require emergency department communication. Selecting emergency department as communication recipient. Confirming acknowledgement with binding audit trail. Escalating urgent findings to referring physician. All for urgent findings now acknowledged. Returning to dashboard with imaging inputs. Annotated chest X-ray with bounding boxes visible. Brain court shows hemorrhage localization precisely. Hematology report auto-detected as third leg. Opening AI Copilot for domain-aware clinical discussion. Ayurveda mode selected for Tridosha interpretation.